Hello, everyone, and welcome back to the module. This week, we are continuing on our topic of engineering the cardiovascular system. And specifically, we're going to focus on the various cardiovascular diseases that can happen in the heart and the cardiovascular circuitry. What we're going to do is we're going to start with the diseases. We're going to look at all the reasons that these diseases cause the different lesions involved. We're going to look at how the prior areas which we've looked at, the fluidic features, the material composition, all of that comes into play when a certain type of disease is caused. What we've done so far is we've looked at the importance of cardiovascular science and some historical perspectives, and we've had a relatively thorough study of the circulation circuitry, and we've had a very important chat about, especially in the in-person class, the fluidic features of circulation. What we're going to do is now we're going to use that information and background to understand various types of cardiovascular disease, and also to understand the treatments and biomedical device innovations that have been made, all the progress in this area to eliminate and in some cases even prevent the progression of these sorts of disease. So without any further ado, let's jump in. You've already seen this graph. What it shows is that the prevalence and spread of cardiovascular disease amongst the individuals has actually increased as a cause of death. Usually, as you can see in this graph, it was other sorts of disease that were the main causes of death. When we came to the early 19s, those were eliminated thanks to all the progress in medicine. So we no longer had those issues that we had early on in the 17th and 18th century. But then what happened was that we started to see more and more heart disease related deaths, and the reason was that we had a very poor understanding of our cardiovascular system. And as you saw, we actually were able to model this system more and more accurately as we moved forward in the 20th century, and we finally arrived at a very accurate model. And today we have very nice and patient-specific, models of the individual's cardiovascular system. We can understand their various flow characteristics, the pressure performance curves. We can look at the flow rates. We can look at the ECG signals, electrocardiograms. We can see if they're in sync or out of sync, and then we can basically identify each and every bit of that pulse plot that you saw previously for the pressure variations. We can see what exactly corresponds to which region of the cardiovascular system, and then detect whether it's a problem in the aorta or it's something in the ventricles. So basically, a lot of progress has been made, meaning that now cancer and other causes that have been less studied, and also we've got lots of question marks looking at those sorts of diseases, cancer, neurodegenerative disease. They are taking off, but still we're at a point where heart disease is the number one cause of death, so cardiovascular disease in general. And so as you can see, the plot basically experiences a drop around 1960s, where there was lots of progress in curing these types of disease, and then it's continuing on to drop, but still it is at a point where we are beyond the point for cancer. But moving on from this, you actually also saw that in terms of demographics, it's not limited to a certain country. It's not limited to the industrial aspect of countries, whether they have more heavy industries involved, or the level of pollution, etc., has a lot to do with the availability of a lot of treatments, with the dietary habits, with the activity rates, all of that, as we'll see. Here you've got a list of those risk factors. And what you see here is that, these are some very interesting numbers. About 1 out of 5 deaths in cardiovascular diseases are attributed to smoking, which is amazing. And secondhand smoke is when you're not smoking, but other smoking in your proximity is influencing you. And in that case, you have about almost 50,000 deaths per year in I think this is actually in the United States, but in the UK also. It's crazy that you have from secondhand smoking, you have about 2,700 deaths in a very young age, right? 20 to 60. And basically 8,000 above 65-year-olds are now, the major. This is huge, because if you look at the number of deaths for breast cancer, it's about 40,000 women per year, and it's about 50,000 heart disease deaths. And I think, again, this is in the US, but it's similar, a little bit more or less, in the entire world, coming from secondhand smoke and through cardiovascular disease. So this is major. And cholesterol is another factor apart from smoking and tobacco. When it comes to cholesterol, we have a large portion of people actually, unfortunately, are at high risk. And the more important problem is that they don't know about it. So in the UK, we have 6 out of 10 that have cholesterol, high levels of cholesterol, that puts them at risk. And in the US, it says about 40 million Americans have levels that are considered high risk. In this case, it's more than 240 milligrams per deciliter. Hypertension is the other leading risk factor. If you have high blood pressures, and if this is a persistent condition, then gradually it can bring trouble. What you have here is, again, it seems like it's a leading risk factor, at least to date, in stroke. And inactivity is another one that it's very significant in today's world, especially. We have a basically relative risk of, it says, 1.5 to 2.4%. This is actually still quite significant. And what you see is basically these 4 are the major risk factors, but there are many other risk factors. There are congenital heart diseases, we'll see, that don't even come from one of these. It's just a genetic thing, and it happens, from birth. So these are just to give you an idea. And basically, we also mentioned that it doesn't vary. Both males and females have, relatively a huge portion of deaths and coming from cardiovascular diseases, and also in general, the occurrence of cardiovascular diseases is pretty uniform between the two genders. What we'll see is here that some diseases there is a slight difference, but the majority of it's very, very, very similar. So now we're going to specifically focus on cardiovascular disease. We're going to go from one class to the other, and for each we're going to introduce the main subclasses, and we're going to talk about what these are in practice, what the treatments are, and why these various kinds of diseases happen. So we have acquired cardiovascular diseases, which means that they don't exist from when you're born. They actually, you acquire them as you go forward. And some of these have a very complex cascade of various biological events happening until it leads to the final disease condition. But we will try and cover the main steps involved in each, and the main, again, risk factors and the reasons that these happen. The first class is vascular diseases. Okay, so diseases that involve the vasculature, the circulation, not the heart itself. And the first one here is arteriosclerosis. Arteriosclerosis is any kind of disease that happens with the arteries. And what happens is that usually it involves changes in the wall of these vessels. So in this case, you see we have coronary artery disease and carotid artery disease. They're pretty much similar. It's just that one happens in the coronaries, again, surrounding the heart tissue, and the other happens in the carotids, where actually you still remember the common carotid artery, which we went through those slides looking at the physiology of these, the anatomy, more to say, and then it splits to the internal and external carotid arteries, and you can see that this happens in the majority of the cases in the junction, where the common carotid artery splits into two, the internal and the external carotid arteries. And here you have coronary artery disease again. In this case, the coronaries can actually have this thickening and buildup of plaque, which again is considered arteriosclerosis. We're going to talk about the exact definition of this in a minute, but as you can see, it's the buildup of plaque, thickening of the wall, which then causes further issues. So arteriosclerosis, again, as I mentioned, it's a general term. It includes various diseases related to the changes in the wall of the arteries. And it's usually the thickening and stiffening. So it becomes more stiff and less elastic. And that's because the plaque material is very stiff. So what happens is, there are versions of this, basically subclasses. Atherosclerosis is one, and this includes basically the accumulation of fatty material rather than calcification, which is stiff. In this case, fatty materials, it's a little bit softer, and these can actually happen in the arteries that come as a supply, carrying the supply to brain, but also to the other tissues such as the heart, the coronaries, as you could see, and the aorta, and various other organs. Atherosclerosis, depending on where it is, for instance, here in the brain, if it's the carotids, what happens is that it can cause stroke. If it's in the heart, it can cause heart attack. And the way it causes that is usually the detachment of the plaque. Again, we'll get to the specific cascade in a minute. What happens is it involves the intima mostly, and in the case of arteriosclerosis, again, that's a version that involves, rather than the arteries, the arterioles. And the arterioles, again, are the branches that, as you move towards the capillaries, they branch off from arteries, and then you've got arterioles, and then you've got capillaries. What is usually considered the main cause of this type of disease is blood flow regimes. So blood flow patterns are usually the key player in these types of disease. The situation is that although these diseases are systemic, meaning that we looked at the risk factors like, smoking, like cholesterol levels, and these are systemic in nature, meaning that it influences the entire human body. It's not just in one specific focal point in your vascular circuitry, but the disease happens in a certain point. Okay, so although these factors, again, cholesterol level, blood pressure, etc., exist in the entire circulation, these types of diseases happen, lesions happen in certain focal points in your cardiovascular circuitry. And the reason for that is they usually are initiated by geometrical variations in those regions, and therefore the flow patterns are influenced. And the flow patterns in that region, that there is a geometrical change, are the initiator of a chain of events that then basically concludes in this lesion. So again, blood flow forces are the major, the key players of this type of disease. And what happens is usually they cause a cascade of other occurrences. And so here in this slide, we're looking at that cascade. So what happens is it all starts from endothelial dysfunction, which usually happens because of these irregular flow regimes. And so you have increased permeability, and this means that you can have those lipoproteins permeating through and building up. And then you also have cells such as monocytes now can get transformed into cells that adhere to the blood vessel walls. So these are the early occurrences. Monocytes are a type of blood cell that, again, are carried through the bloodstream, but then because of these changes in the endothelial cell layer, it can be either permeability that then causes changes in the hemodynamic conditions, and again, as I mentioned, the permeability of lipoproteins. But then in general, what happens after those events is that the properties of that surface is influenced. Monocytes can then adhere to those walls and help and aid the accumulation of fatty materials, which had already started because of the increased permeability. And then what happens is foam cells start to form, and then muscle cells gradually start to migrate through the wall. And that's the initiation, basically, where they start to migrate from the media, as you can see there, into the intima, and it becomes more and more of a larger plaque with those fatty cells, as well as now the smooth muscle cells, and it gradually becomes a natural part of the wall where these are just growing inwards. And then what happens in the advanced lesions is that these foam cells start to thicken the inner lining, and they basically fill it with a substance that is made of fatty material, and it's usually cholesterol. And so then the smooth muscle cells and connective tissue also continues to just build up there, and sort of migrate towards those inner regions of the vessel, and it gradually becomes larger and larger plaque. And this plaque becomes so large that the influence on the flow characteristics is so significant that the flow forces then initiate a rupture, and the plaque detaches from that site because it's considered an external body. This lumen around it can perfectly manage itself, so this plaque becomes an individual entity that can then rupture and move on. Now, for that region there, it's fine. They've gotten rid of the plaque, but the problem is it then moves on to initiate a thrombosis, which is, or blockage of another vascular site, which is downstream of this and has a smaller diameter. So what happens is that then those secondary effects are detrimental and can potentially lead to strokes and heart attacks. So this is really the cascade of events that happens. Again, it all starts with the change of flow properties, which changes the directionality. This image here is showing that it changes the directionality. You change the shear stress. These endothelial cells are extremely sensitive to shear stress. Their morphology changes, their permeability changes, they have leaky junctions. So that's the start of the basically the permeability of those fatty lipoproteins and the adhesion of monocytes, and then the monocytes start to initiate the accumulation of fatty materials. You have foam cells, and then those actually initiate the migration of smooth muscle cells, and so on and so forth. It starts to again increase the size of the plaque, and then the detachment. And also this is really the cascade that's most well known, but there are various sub events involved in this process, that can make the condition accelerated, or they can actually slow it down and heal the lesion. So the second type of cardiovascular disease, which again falls under vascular diseases, is aneurysms. And aneurysms, you're typically dealing with a case where you have an enlargement of a certain region. Again, it's a narrow focal disease. So you have it happening in a certain region. And in this case, what you see is that it's happening in the abdominal aorta. So again, it's as you follow down from the aorta, you can see in this image here, in this region in the abdomen, this aortic region can get enlarged. And this isn't the only region where we have this. It can happen in the brain. So we have, again, a leading cause of death in aneurysms. It's the cerebral aneurysms, where you have this enlargement as a sac which grows and grows and grows. And again, it influences the flow properties. So the flow coming through here gets recirculated there. You have a turbulence, you have various kinds of shear stress, which then cause the same cascade of reactions to accumulate fatty material and then become even larger as it becomes more and more flexible. So the two types here again, abdominal aortic aneurysm and cerebral aneurysms, they come in various shapes and sizes and in various regions in the brain. So what happens in this case is that they progress, they become larger and larger, and then they burst, which is a very unpleasant event and can cause death on the spot for a great portion of patients, about 70 to 80%. In the case of abdominal aneurysm, die on the spot. So about 70 to 80%, as soon as it ruptures, they die because the internal bleeding from the abdominal aorta is so huge. It carries a lot of flow. The ones you can see here are cerebral aneurysms, can also cause the same issue in the brain because of the sensitive regulation of flow there. And that's it. So here, again, looking at aneurysms, the chain of events starts from the extracellular matrix that surrounds the vessel. And as it degrades, the vessel wall gets more and more prone to damage. It becomes thinner and more compliant as it's degraded. The basement membrane and the extracellular matrix is degraded, causing it to become less and less stiff, and therefore it starts to deform under the pressures of, in this case, the abdominal aorta. And in that region of the abdomen, the aorta just continues to enlarge and enlarge, get thinner and thinner, until this large sac region there can break and burst under pressure. And again, the flow rate, the amount of bulk flow is so huge that this can immediately cause significant amount of bleeding and basically lead to death. Here it shows that about 30% of people from cerebral aneurysm, you have deaths on the spot, and in the case of abdominal, you actually have 8 out of 10. Actually, Albert Einstein died of ruptured aortic aneurysm, and again, it's very common that there is no cure on the spot, and even if it continues on to the surgical theatre, there's not much that can be done. And even if you can make it there, it's very unlikely that they can do something in time. So again, blood flow, as we looked at it in the case of arteriosclerosis and atherosclerosis, it also happens here in aneurysm, that it all starts with irregular flow regimes. And in the aorta, again, you have a huge flow rate, you have a huge blood pressure, because it's still this extremely high blood pressure hasn't still dampened away. And so that flux can actually expedite and accelerate the growth of these aneurysms. And then when it bursts, it can very quickly lead to death, as you've seen. The risk factors, again, are noted to be hypertension and smoking, but there are also variabilities in the population depending on the genetic markers of this, and also depending on the sex. So again, very common cause of death here. Another sort of disease, when we move from vascular diseases, a subcategory of cardiovascular disease are heart diseases. And these directly influence the human heart. The two that we're going to talk about today are congestive and congenital heart failure. As the name suggests, congenital, something that exists from birth. Congestive, we'll get to in a minute. And they all manifest themselves in terms of the lack of performance and the hypertrophy that happens because of, the overload in the heart, and usually in the left ventricle. So what happens in these cases is that it can get worse and worse every day. So in this case, you can see in this image here that the left ventricle, the size of the left ventricle is increased, the internal size and the wall has gotten thinner and thinner. Dilated ventricle is what you're looking at there, and this means that the volume of blood circulated here is much greater, meaning that if the heart capacity cannot handle that, there'll be some remaining blood here from the previous cycle that hasn't been circulated. So this is actually the most frequent cause of hospitalization amongst the elderly. Very huge number, about 1 million admissions per year. That is huge. And again, as I mentioned, it happens in the elderly because the function, the performance of the heart declines, as we saw previously. That pulse there, that pressure displacement plot, as we travel through the cycle, the performance of this pump, this natural pump, our heart, is actually reducing through time, especially if there's inactivity. And what happens is then, as these lesions grow, as you get worse and worse hypertrophy, what happens is that it cannot manage to compensate for that anymore. So what we know again is that the heart is a very precisely timed pump, and the electrical and mechanical signaling has to be synced very well. If there's a very tiny what we call arrhythmia between the two, it can cause major issues that can quickly build up towards a much more significant condition. And our hearts are really designed in a healthy individual to have more than 10 billion cycles in a lifetime. So they can cover your circulation needs for over a century. But the reality is that many of us, unfortunately, don't make it that far because we live an unhealthy lifestyle, and the heart conditions can get worse and worse. And a lot of it was also congenital, of course. Now, when we look at congestive heart failure, again, as I mentioned, heart failure, we're referring to the case where the heart is a pump, and this pump isn't acting and performing properly. What happens is that usually it's either an irregularity in the blood flow, and that's because this pump, the geometry, the internal chambers has changed, and therefore it cannot pump the blood effectively. And usually it's considered as a leading cause of hospitalization, as I mentioned, for the elderly, especially again because of the lack of performance in the heart. It influences the left side, which is the main pumping force of the heart. It all usually comes from the left ventricle because it's pumping that high pressure blood flow, and it's a lot more active than the right ventricle. And again, there are risk factors. Arrhythmia is the most significant because it's again that out of sync performance of the heart, where it's taking a pressure front earlier on, earlier than when it should. So it's maybe contracted, but it's receiving that influx from the pulmonary vein, and it's just this out of sync, the turbulent flow coming in the ventricle can then damage and deteriorate the cellular structure. And so there's this out of sync behavior can be a leading cause for that. And then also you have ischemic heart disease, and then hypertension, of course, which also are leading role players. And here you see hypertension and myocardial infarction can actually, because these are involved in the downstream of this pressurized circuitry, can also contribute to the upstream pulsing. So when it comes to, again, the congestive heart failure, the steps involved are, again, mainly the changes in the mechanics and the flow. So as I mentioned, in the first week, you'll see that the blood flow plays a major role. And already you've seen that when it comes to arteriosclerosis. It's the blood flow regimes that have changed because of geometrical changes in that region. And it goes hand to hand. It's a egg and chicken problem. So you actually don't know exactly whether it's the irregularities of the blood flow pressure and flow rate that can happen because of an unhealthy heart performance that can cause downstream issues in the arteries, or whether it's actually the geometry of the arteries that initiates the formation of the plaques. But in either case, it's the flow rate, the shear stress that mediates the endothelial cell permeability changes and the various events that happen afterwards, as we mentioned. And now you're seeing that in heart failure, it's similar. Now, in heart failure, what happens is very interesting. So what you have here is you have a vortex that happens when you go from the aorta to the ventricle on the left-hand side. Now, this vortex, it actually progresses through and builds up as it travels through the ventricle. Now, if the size of the ventricle isn't optimal, if it becomes too small or too large, what happens is that this vortex, the geometry of this vortex can be influenced because it then collides with these walls, and boundary condition dictates different shape for the vortex. And the vortex here, why is it important? It's known that it plays a very important role in the cardiac cycle. It helps the circulation, actually. So under healthy conditions, this vortex can actually optimize pumping. It can help the pumping cycle. So it comes from the aorta to the ventricle, and it's pumped back through to the atrium to the ventricle, and it's pumped back through the aorta to the body. This vortex helps it carry through and move on to the aorta and get circulated in the entire body. So the lack of this vortex, or its basically change due to the internal geometry of the ventricle, can lead to a lack of performance in the pumping behavior of the heart. So another thing that happens is that can also influence the vortex, but also directly influence the performance of the cardiovascular system, is that, as I mentioned, if this gets larger and larger, the performance of the heart cannot handle the circulation, the full circulation of this ventricle. And so there will be remaining amounts of blood here from the previous cycle. So when the oxygenated blood enters, it's going to collide with some blood that's there already. So you can see that, and this image shows it beautifully, the vortex here, and how easily it can be influenced by the geometry of the heart here. This is very nice phantom model, an acrylic model of the heart showing the circulation, all the nice streamlines here. So what you want to really take away from this is that we're looking at a interconnectivity of the mechanical behavior of this tissue, and this is really important in the cardiovascular system. It's not as significant, let's say, in the respiratory system, but in the cardiovascular system, it's all about mechanics, motion, fluid dynamics. And that's why it's really important to understand that these recirculated flows, the vortices, and their healthy progression through the ventricles can play a major role in the heart performance. And then that heart performance and the gradual changes of these muscles around can also be the other side of this, where you have a deterioration of the muscles here because they're having to keep up with that change of performance. So it can be various things. It can be the lack of that performance. It can be the downstream effects coming from the muscle cells surrounding this region to become more and more bulky and chunky, all becoming more and more weak. And this causes, again, a deterioration in performance, and therefore this lack of performance, this lack of coordination can cause heart failure or the lack of performance again. So the other type of heart disease that we usually have is congenital heart disease, and that's something that happens in from when you're born, if you're born with it, but then it gets worse and worse. So there are some very amazing observations. So this one here, for instance, is a septal defect that can happen in infants, and basically means that these two left and right sides have flow between them. So there's a mixing of these fluids, which is just ridiculous. Now that you've seen the performance of the heart in full, you can see how detrimental this is. But there are various other types of geometrical defects that cause, again, a lack of performance, not as severe as this, but again, another type of lack of performance in the heart. So what it says here is that it's a structural problem. It's a geometrical feature that can easily be seen in the images that you take from an infant, and it's very common, and it's number one cause of death, coming from birth defects. As you can see, the heart plays a major role in the body, and a small defect like this can be significantly detrimental to its performance. And the number isn't that high, but it's still quite high. So if you look at 1 to 100, it isn't a small population. There's millions of newborns worldwide. So this basically, there's nothing you can do about it early on apart from having surgery. And this actually causes the same sorts of things that happen in congestive heart failure. So it causes a overload usually and hypertrophy, and then things just get worse and worse from this point. It can then gradually grow on to then influence these walls of the heart, change their mechanical performance, and change their basically the composition of these, the relative ratio of the smooth muscle cells and the fibroblasts, and therefore just in general change the stiffness and performance of the heart, very much similar to the congestive heart failure. And these are a couple of other cases where you can see some very irregular shapes. So here you have in the aorta you have this stenosis, which we'll get to stenosis in a minute, but it's basically this increase in the wall thickness, very similar to atherosclerosis and arteriosclerosis. And in this case, you see that the aortic arch is connected to the pulmonary artery, which is again an amazing case. They're super close, but in the morphological changes that happen very early on in the infant, before their birth, this bridging can easily happen between these two lumens. So you can see various types of this again here, and that this can cause significant lack of function in the circulation and pumping. And so these have to be cured. There has to be a surgery. In a lot of cases, you have an open heart surgery. And again, here you see another irregularity that are here you see that you've got two influxes. This is amazing. The vena cava has an entirely different geometry to it here. It's very similar to the arch there in the aorta. So I'm going to stop here, and we'll talk about valvular diseases. That can another type of cardiovascular disease that can cause a lack of function in your heart valves in the next lecture. But for now, let's conclude here, and you guys can take a break and we can get back for the next lecture. Thank you.